Welcome back to The Explainer. Today, we're basically putting on our detective hats and launching a full-scale medical investigation into something deeply personal, often misunderstood, and honestly, completely fascinating. We are talking about the health of our scalp. If you've been noticing changes in your hair lately and wondering what in the world is going on up there, you are absolutely in the right place. We're going to break down the evidence, uncover the actual culprits, and look at the proven science for getting things back on track.
Okay, so let's dive right into this. It's a question that brings up so much anxiety. Why is my hair falling out? If you have ever felt your stomach just completely drop because you found extra strands on your pillowcase in the morning, or you noticed a way larger clump than usual tangling up the shower drain, I really want to validate that experience for you right now. It is incredibly stressful. But before we panic, we need to look at the biology.
As our source material perfectly captures, it's not easy to dismiss finding extra hair on your pillow, in the shower drain, or tangled in your brush every day. You know, it is totally normal to lose some hair daily, but the math is pretty simple here. When more strands fall out than are actively growing back, a fundamental shift has occurred in your body, and that shift has a root cause that we can, and definitely should, identify.
So, here is a quick roadmap of our investigation today. 1. The hair loss mystery. 2. Biological and genetic causes. 3. Lifestyle and medical triggers. 4. Practical habits for regrowth. And 5. The Dr. Groot regimen.
Section 1. The hair loss mystery.
To really understand what's happening on our heads, we kind of need to change how we think about hair altogether. I want you to imagine a garden. Your hair isn't just a physical strand, right? It's a plant growing out of soil. Visible hair loss is just the symptom. The actual problem starts with an invisible disruption way down in the roots, in the soil of your scalp. And if your garden is struggling, you are absolutely not alone. This is a universal human experience. Hair loss affects millions of people across all ages and all genders. It happens whenever the natural, continuous cycle of hair growth is interrupted. There's a lot of stigma and silence around this, but scientifically speaking, actually, scratch that. It's just a mechanical disruption that we need to solve.
Section 2. Biological and genetic causes.
Let's look at our first category of suspects. Sometimes the blueprint for our hair's life cycle is literally written right into our DNA or heavily influenced by internal hormonal shifts that are completely natural, but, let's be real, still very frustrating. Take a look at this massive number, 80 million. That is the estimated number of individuals in the United States alone who are dealing with hereditary hair loss. I mean, that proves just how incredibly common the genetic factor really is.
Now, the official medical term for this hereditary hair loss is androgenetic alopecia. Basically, it means that as you age, your genetics dictate that your hair follicles will gradually shrink. They produce finer, shorter hairs until they eventually just stop producing hair altogether. It is the single most common cause of baldness.
But notice how the exact same genetic condition presents so differently depending on your gender. For men, androgenetic alopecia typically shows up as a receding hairline or a distinct bald patch starting right at the center of the scalp. For women, though, it rarely causes completely bald patches. Instead, it shows up as an overall thinning across the top of the scalp, which is often noticed when a hair part starts looking wider than it used to. And you know, hormonal changes like pregnancy and menopause can also trigger very similar thinning patterns.
Section 3. Lifestyle and medical triggers.
If genetics and hormones aren't the culprits, we have to look at the environment. And this timeline solves one of the absolute biggest mysteries of hair loss, the delay. Let's say at month 0 you experience extreme emotional stress, or your protein intake takes a sudden nosedive. Your body basically panics, goes into survival mode, and hits pause on hair growth. But the hair doesn't just fall out right away. It sits there in a resting phase. It isn't until month 3 that the shedding actually begins. This delayed reaction is exactly why people often fail to connect the trigger, like a bad breakup or a crash diet, to the hair loss that's happening months later.
Clinically, we have terms for these disruptions. Telogen effluvium is that stress-induced delayed hair loss we just talked about, where the follicles are pushed into a resting phase prematurely. Contrast that with anagen effluvium, which is a rapid hair loss during the active growth phase, and that's typically caused by harsh medical treatments like chemotherapy.
Let's build a larger profile of potential triggers because it's not just stress. Common medications, things like blood thinners, birth control, or acne meds that are high in vitamin A can actually list hair loss as a side effect. Then you have thyroid disease. Whether it's overactive or underactive, it disrupts normal growth by prolonging that resting phase.
Even fungal infections, like ringworm or severe dandruff, can cause serious inflammation that literally chokes the follicle.
And finally, we have the physical suspects. Basically, are we causing the damage ourselves? Hairstyles that pull tightly, think tight braids, extensions, or super tight ponytails, cause what's known as traction alopecia. And repeated pulling can actually make this permanent, which is scary. Add in the chemical assault of perms and bleach, plus the excess heat from daily styling tools, and you are creating a perfect recipe for massive breakage and shedding.
Section 4. Practical habits for regrowth.
All right, we've spent enough time on the problem. Let's pivot to some empowering solutions. We're going to shift our focus to cultivating an environment where hair actually wants to grow. Here are the foundational, actionable habits recommended by dermatologists. First up, switch to a gentle, sulfate-free cleanser. Stop those damaging styling habits we literally just talked about. Next, if you suspect nutritional gaps, particularly with iron or protein, address them with real food first before you blindly start reaching for supplements. Excess vitamins can actually make shedding worse, believe it or not. And lastly, for hereditary issues, seek early medical intervention like minoxidil or platelet-rich plasma ingestions. The key here is do not wait.
So the absolutely crucial point is this: prioritize your scalp health. Think back to our garden analogy. You cannot grow a beautiful, lush plant in toxic, dry, or suffocating soil. It just won't happen. A clean, hydrated, nourished scalp provides the absolute best foundation for your hair to recover and regrow.
Section 5. The Dr. Groot regimen.
Now we are going to look at a specific toolkit that's designed around the exact philosophy we've been discussing, treating the environment where hair growth actually begins, rather than just masking symptoms on the dead strands of hair themselves. Let's walk logically through this Dr. Groot in-shower routine. Step 1 is the hair thickening shampoo. And this isn't just about cleaning hair. It is specifically formulated to clear away that follicle-clogging buildup on the scalp without stripping its protective barrier. Step 2 is the Miracle In-Shower Treatment. This is a liquid formula you apply to wet hair that improves scalp health and revitalizes the strands in literally 5 seconds. 5 seconds. Step 3 is the hair thickening conditioner, which locks in essential hydration, leaving your strands visibly fuller and way less oily.
But the regimen doesn't stop when you step out of the shower. Step 4 is the hair thickening roll-on serum. You apply this directly to the scalp between washes. So why is this a game changer? Because it continuously feeds the follicles on your non-wash days with active ingredients like biotin, caffeine, and niacinamide. It ensures your scalp is getting treated consistently, not just a few times a week when you happen to shampoo.
And what happens when you treat the scalp consistently with this complete system? You get this incredible number, 82.2%. Clinical results showed an impressive 82.2% reduction in hair loss due to breakage when the full Dr. Groot Scalp Revitalizing Solution routine was used consistently. By strengthening the foundation, you literally save the hair.
The clinical trials tell an incredibly dramatic story. Look at these improvements across the board. We're talking about an astonishing 169% improvement in scalp hydration, a 100% improvement in visible scalp redness, which means the inflammation that was choking those follicles is just gone. And, as we just mentioned, that 82% reduction in breakage. It all points right back to a healthy scalp.
Which leads us to our final, thought-provoking question for today. Take a real look at your own routine. Is it time to stop endlessly treating your hair and start treating your scalp? Remember, the health of the garden depends entirely on the health of the soil. Thank you so much for joining me on this explainer. I really hope this investigation gave you some clarity, a little peace of mind, and a clear path forward. Keep questioning, keep learning, and I'll catch you next time.